Imagine a world where the very person tasked with overseeing the nation's healthcare system is a vocal critic of vaccines, sparking widespread concern among medical professionals and politicians alike. This is the stark reality we're facing with Robert F. Kennedy Jr. at the helm of the Health and Human Services Department. But here's where it gets even more alarming. His new MAHA report has just been released, and it's a must-read for anyone who thought he might bring about positive change to the healthcare system. As it turns out, Kennedy's plan is riddled with controversies that have left many experts scratching their heads. When President Donald Trump appointed Kennedy as Health and Human Services Secretary, there was a mix of reactions from politicians and doctors. Some were cautiously optimistic, thinking that any potential harm he might cause to vaccine standards could be balanced by his promised reforms to tackle chronic diseases. However, this optimism might be short-lived, as Kennedy's new report reveals a more complex and troubling picture. And this is the part that most people miss. The report's implications go far beyond the realm of healthcare, touching on fundamental aspects of our democracy. But what does this mean for the future of our healthcare system? And how will Kennedy's plans affect the most vulnerable members of our society? These are questions that we'll delve into, and they're crucial to understanding the potential consequences of Kennedy's actions. As we explore the details of the MAHA report, it becomes clear that Kennedy's stance on vaccines is just the tip of the iceberg. His views on chronic diseases, mental health, and the role of natural sources in healthcare are all part of a broader narrative that has sparked intense debate. For instance, his opinion piece with Linda McMahon, where they argue that children need natural sources of mental health, has raised eyebrows among many experts. But is this approach really the solution to our mental health crisis, or is it just a misguided attempt to simplify a complex issue? And what about the potential consequences of his plans on the most vulnerable members of our society, such as children and the elderly? These are questions that demand careful consideration and nuanced discussion. As we navigate the complexities of Kennedy's report, it's essential to acknowledge the controversy surrounding his appointment and the potential implications of his plans. Some might argue that his views on vaccines and healthcare are a refreshing challenge to the status quo, while others see them as a dangerous threat to public health. But here's the thing. We can't afford to be complacent or dismissive of opposing views. We need to engage in a thoughtful and respectful discussion about the future of our healthcare system and the role of figures like Kennedy in shaping it. So we ask you, do you think Kennedy's plans are a step in the right direction, or do they pose a significant threat to our healthcare system? Share your thoughts in the comments below, and let's start a conversation that can help us better understand the complexities of this issue. As we move forward, it's crucial to remember that the future of our healthcare system is not just a matter of politics or policy. It's a matter of people's lives. And it's up to us to ensure that we're creating a system that truly serves the needs of all citizens, regardless of their background or circumstances.